of numbers. Thankfully, it's almost the end of earnings season. It's been quite a rough one for the last few days, but today we'll probably be pulling the curtains down on the earnings season. But a couple of companies came out with a set of numbers, so let's get straight to that. Global Health reported strong revenue growth in the third quarter. The company also maintains its margins around the 23% odd mark, while the profitability was much higher in trade. We have the chairman and managing director, Mr. Naresh Trehan, as well as Pankaj Sahni, the group CEO, who joins in on the show. Good morning, gentlemen. Thanks so much for joining in. Well, let's discuss a couple of those numbers then. The occupancy was at around 59% for the past quarter. Could you give us a sense what was the surgical mix in there, and what's the trajectory in terms of occupancy from here on? Go ahead.
Morning, and thank you for
take it, Pankaj.
One of the key aspects for us as we move forward out of this 9 months and the last quarter is we've seen revenue growth by about 21%, EBITDA growth 22%, and profit after tax growing about 26%. So we are very confident and very happy with our performance so far. We've also added in a significant number of new beds. As you may be aware, our Lucknow and our Patna facilities continue to ramp up beds. So as you see the installed bed capacity increasing, added almost 170 beds in the last few months, you will see that the installed capacity will increase. Our volumes have grown about 31% over the 9-month period in terms of our inpatient admissions. So all in all, very strong performance across all of the units. Fairly happy with the growth that we see coming in. And we continue to focus in on strengthening our core. We've added some leading clinicians into our mix. Dr. Randeep Guleria joining us in our Gurgaon facility.
Pankaj, we have a fair sense in terms of your numbers, and we appreciate the efforts that you're putting in. But from a stock market perspective, you'd like a couple of quantitative details. One is, how does the occupancy move from here on? What would the surgical mix be out there? And also, if you could give us a sense on the average revenue per bed. So both these two numbers. Let's take it.
So our average revenue per bed, as you see, is about 58,000. That's without considering our outpatient pharmacy. If you add that in, that comes to about 60,000. And that's grown about 10% over the course of the last 9 months. Continues to be at the top end of the market and continues to be strong, given the complex work which we do. You asked about our surgical mix. A lot of our caseload is very high-end, high-complexity surgical work. We get about 80% plus of our patients' revenues come in from our inpatient work, the majority of which is high-end surgical work. As you look at our occupancy trajectory, we see that fairly strong. The important point to mention, though, is that we will see capacity addition, and as capacity addition kicks in, you will see some amount of variability in occupancy because the denominator keeps changing. But the important point to note is that our occupied bed days have grown by about 10%. Our inpatient volumes growing about 30%. So since we are in a growth phase with our bed additions, you will see some amount of variability in the occupancy at a group level. But overall, we continue to see strong momentum across the units.
All right. Could you give us a sense on a couple of things then? Dr. Trehan, just wanted to understand your thoughts on EBITDA margins. This time around, it's coming at 23%. Is it sustainable as, occupancies increase further, but at the same time, you all will be investing in newer capacities as well? So thoughts on that. And the second one was on international patients. While your overall business grew slightly upwards of 20%, the international business on a low base, understandably, grew over 80%. It forms 6% of your revenues right now. Where do you see that number headed? What was it pre-pandemic? So on EBITDA margins and international patients, Dr. Trehan, if you could give us your sense.
So you know that we are actually providing the highest end of medicine, whether it would be cancer, whether it would be surgical specialties. So we continue to move up the value chain in cutting-edge treatments. This has been our core strength, and this is what we maintain no matter whether it's in our flagship in Gurugram or in the new facilities that we have created. So we move on like on a daily basis, we are creating new things. So like even in the last quarter, we added lung transplants. Now, lung transplants, we've successfully started the program. We've done several and successfully. So we then have also brought in several new physicians who are doing like high-end, like we have one team which has joined us for uro-oncology. They super specialize in robotic uro-oncology. Then we have added mother and child in Lucknow and in Gurugram. The basic thing is that we are the cutting edge on critical care. So even in the mother and child, which is traditionally just babies and all, we have a very large system for critical care for neonates. We don't from our own facilities, but from all around where newborns are sick and need specialized care. Similarly,
Dr. Trehan, we understand. Dr. Trehan, we understand and we thank your commitment to society and the ability that you want to bring the best of the lot to patients, etc., and bring out critical care too. But Pankaj, if you could give us some quantitative details, margins, where do we see them going from here, and international patients, when do they go back to pre-pandemic levels?
So let me start with your second question first. International business, which pre-pandemic was about 8 to 10% of our top line, has not yet reached the levels that they were before COVID, although we do see some growth coming back. Currently, about 6 to 7% of our top line is international business. We've seen some substitution from patients coming in from Afghanistan that now getting replaced with other countries. So we see strong growth in Iraq, Bangladesh, a lot of CIS countries, as well as a good amount of potential for patient growth from the African continent as well. So we feel good about the international business as we move on. There's also a lot of momentum from the government with the Heal in India and Heal from India initiatives. So that should help the industry as a whole in terms of attracting medical value travel patients. In terms of the EBITDA margins, we've been maintaining strong EBITDA margins at about 24%. We see that there is no reason for any kind of worry on those. As you are aware, we don't give out forward-looking statements, but with our expansion into our additional beds in Lucknow and Patna, we do believe that the incremental growth which will come in, given that we've already put a lot of investment into the ground, we've already got the teams in place, will of course be able to deliver revenues at a higher marginal profit, because the cost, of course, to serve every incremental patient is significantly lower. So we've been fairly strong with our performance over the quarters. We feel confident as we move into the next quarter as well as in the subsequent years. And we've also continued our growth. We've added on a 300-bed hospital, which we will be having in Indore as well on an asset-light model. So growth all around, both in occupancy as well as performance.
All right. Thanks so much, Pankaj, for joining in, Dr. Trehan as well. And before we wrap up, I have a colleague of mine who's just outside the studio, and they've just given me some feedback on my mails that your facility in Patna is top class. The colleague's mother is admitted out there, and he believes that the service you're providing out there is absolutely top class, much better than any of the hospitals in the vicinity as well. So kudos to you and your team. It's just a feedback that I just got in, so I thought I'll share it with you all. All the best. We look forward to discussing financials as well the next time we chat. Well, for the time being, though, we'll slip into a short